sick, but he had to go pick up his wife from work. While he was driving, he kept swerving in and out of lanes. He kept driving behind this guy. When he somehow reached his wife's work, she thought that he had been drinking. His pants were unbuckled. He stumbled and could not talk in complete sentences. Greg went to the hospital and got a CT scan, and it showed some clotting. Which diagnosis could you choose at this stage?
Stroke.
You say stroke?
Mm-hmm.
Why not meningitis or encephalitis?
Because
it wouldn't show clotting. Yeah.
Wouldn't show clotting, and there's no evidence of a fever or anything,
Yeah.
right?
Yeah.
Myasthenia gravis? They have nothing to do with it at all, right?
No.
You're making that argument, you're thinking way too hard. Okay? Questions? Moving on. Jill, a new member of college, has also always been a shy girl. But lately, her reserved behavior has worsened and has been experiencing attacks of excessive fear when noticing others are watching her. It has continually progressed and has become so severe that she can no longer use public restrooms or eat in public. What can you conclude Jill is most likely suffering from?
obsessive compulsive disorder?
Social anxiety.
Okay, social anxiety disorder, because of what big clues?
She just went to college.
Other people watching, judging. She did
Oh,
just go
that's
to
true.
college. It's a new environment.
They're not imaginary people.
They're not imaginary people. Doesn't mean they're necessarily even looking at you, but they might be looking at you. Who knows what they're thinking, you know? But somebody's social anxiety is pretty convinced they're not safe for whatever reason. Okay? 61-year-old woman named Sally walks into the emergency room one day with an enlarged thyroid gland. She says that she has been experiencing extreme weight loss, sweating, and irritability. During the physical exam, her heart rate is rapid and irregular. In addition to her thyroid glands, her eyes are protruding/puffy. After a couple of lab tests, the nurse realizes that her T3 and T4 levels are increased and her TSH levels are low. What condition do you think Sally has? So, hyperthyroidism. Anybody have any questions about this? The most common cause of hyperthyroidism is? Most common cause of
Grapes.
hyperthyroidism is?
Grapes.
That'd be the second line right here. Okay. Keep in mind, by the way, antibodies against THS receptors are stimulating the thyroid gland. Okay? Sometimes people get confused about that because they remember what's a TSH thing, and TSH is a pituitary thing, but it's the receptors that are on the thyroid gland, and then they're stimulating those, which is weird for an antibody to stimulate something like that instead of destroying it like in Hashimoto's. Okay? 30-year-old man came into the hospital after his flu-like symptoms continued to worsen. He complained of a fever and headache, which eventually developed into nausea, vomiting, photophobia, and a feeling of confusion. Upon physical exam, the physician noticed a petechial rash developing on his arm. A spinal tap was performed, which indicated low glucose levels in the CSF. Which of the following is the patient's likely diagnosis?
Yeah, it's bacterial
Okay, it's bacteria because
because of the sugar.
of the low glucose levels. Bacteria is eating that sugar in the CSF. And you're saying the rash, you said meningococca because that is the one we probably didn't even cover in this class, but did we? Meningococca itself causes a petechial rash. That's one of the things. That's not viral, that's a coccus. We didn't talk about viral meningitis. It can be caused by viruses too. Okay? Questions? "18-year-old patient Jessica has had irregular periods since she first started menstruation. Periods are heavier than normal, severe cramping, and often will last for 7 to 9 days. Sometimes she will go without a menstruation cycle for 2 months. She is a volleyball player and reports working out 5 days a week and keeps to a strict diet, but finds she is still gaining weight. Prom is coming up soon, and she has recently noticed hair growing on her upper lip, chin, and neck, and does not want her date to notice it.
Oh, sick.
A pelvic ultrasound was done and showed no abnormalities. Lab work showed an increase in testosterone. What is Jessica's condition?
C.
C.
Yes,
C.
it is.
C.
Yep.
C is correcto. C.
Yeah.
So, some of you may have been worried about that pelvic ultrasound showing nothing. Okay, she's 18. It might not, and I think that's probably where the students were going here. Okay, they will eventually.
What age do they?
Yeah, I don't know. They could show cysts at this age, they might not. That's all I'm saying. By the time she's 30, yeah, probably. Okay? Leslie is a 42-year-old woman that loves waffles and breakfast food,
my.
really. She complains of always feeling fatigued and having no motivation. She is now at her highest weight since she has ever been. She says that whenever she tries to cut back her food intake, she experiences shakiness, diaphoresis, and increased hunger. She experiences polyphagia, but denies polydipsia or polyuria. Her blood pressure was 160/88. Her fasting blood glucose was 170 to 200. I don't know why they didn't give the exact number, but whatever.
Diabetes.
And after eating breakfast, it was over 300. Her A1C was 7.2%. What is Leslie's probable?
Diabetes type 2.
Type 2, you say?
Yes.
What? Yes.
So for this exam, are the specific lab values being memorized ahead of time?
No.
No.
But you guys hopefully can recognize it. That's high blood pressure.
Yeah.
You might want to remember anything over 140 is high. I don't know if you have to, but good idea. Diabetes, you guys wrote a whole paper on it. I'm hoping you guys remember that over 126 and hemoglobin A1C of over,
I'm gonna.
oh great, you all plagiarized your papers. Huh? It was something like that, but it wasn't. You guys remember it all? A1C number sustains diabetes?
Oh, 6.5.
6.4, 6.5, yeah. 6 point, yeah, higher than 6.4 or 6.5 or higher. Anyway, moving on. John is a 65-year-old male who loves exercising and staying fit. When John was younger, he used to do bodybuilding, but stopped once he injured himself. After his injury, his family noticed that he had drooping in his right eye and sometimes showed a weakness in eye movement. As time went on, he knew he didn't want to lose his muscles, so every once in a while, he would go hiking, but he noticed that when he was active, the symptoms would get worse and he'd have difficulty breathing and blurry vision. What does John have?
A.
A, myasthenia gravis.
Yep.
Gravis. Okay, what is that drooping eye called again? Ptosis. Somebody yelled out ALS.
Not me.
Not impossible, but ALS does tend to start in the limbs, by the way, and I'm not sure I ever even mentioned that before. Okay. Shelley has been feeling fatigued lately and has also been experiencing severe nausea and vomiting. Wonder if she's pregnant. She thinks it was just because she ate some bad sushi the other day, but her symptoms are not going away. In fact, they're getting worse. Shelley went to the hospital and was told that she is severely dehydrated. Okay. Lab results showed her creatinine levels were 3, normal's less. And her bun was also high. What condition does she most likely have?
C. Acute renal failure. Pre-renal.
You're saying pre-renal?
Yes.
Why pre-renal? Or are you just guessing here?
She could have been sick.
I think it's because of where it's at and because she's dehydrated in the kidney stones. That's what I'm thinking.
Okay. Doesn't say anything about kidney
Well,
stones.
dehydration causes kidney stones.
So which is it?
C.
Okay. Reason is, you kind of gave me both answers there, is They agree it is pre-renal, but because of the decreased blood flow, that happens before it gets to the kidneys, therefore the kidneys get ischemic and can fail, right? It would be post-renal if it was something like a kidney stone, because that's after it left the kidney, right? And now it's working backwards to cause the kidneys to fail. Does that make sense?
Well, isn't it usually like asymptomatic too? Like,
Acute renal failure?
no, like if there's a big obstruction and until it becomes like infected or,
Until it actually, yeah, it's asymptomatic until it is.
yeah.
But yeah, if the stone starts heading down that little tube, that's definitely not asymptomatic. But again, there was no reason to believe that was an issue here, right? People kind of lead with that one, trying to pass a kidney stone. All right, 47-year-old female comes into the hospital via ambulance due to a fainting spell. She explains that she has been feeling very fatigued as well as experienced arthralgia. She has also noticed a hyperpigmentation to her skin and explained that she has been losing weight over the last few months without trying. After running a few tests, the doctor reports that she has low levels of aldosterone, cortisol, and sodium. Her potassium, not spelled right, was 7.5. Based on the following information, what is Megan's diagnosis?
Addison's.
P-O-T-A-S-S. That is spelled right. Why does it look weird? It looks weird to me for some reason.
Maybe it's just the font or something.
Probably because I haven't actually written a word in 20 years. It's K. Anyway, so you guys came up with what?
Addison's.
Addison's because
The hyperpigmentation. And
hyperpigmentation is a huge clue.
And the low aldosterone.
Yeah, low everything in the adrenal cortex, right? Yes? Questions?
Do we know what day?
Do we know what?
Do we know that it's?
Did you know?
We don't, right?
You probably don't. We kind of skipped it over because,
Isn't that when
So the type of.
you have it and get better, you get serious?
yeah, it's a very temporary, you get a hyperthyroid, you get sick like the flu. And then you get like a hyperthyroid state, and then you get a hypothyroid state, except it's all very subclinical. It's very like minor stuff. So it's very hard to diagnose because a lot of people won't even bother getting treated because they just feel,